All right, so this is my 10th day post-op from TJR Le Fort one piece and Genioplasty, and still doing pretty good. Everything's still kind of tight from the swelling, so like I'm really trying to smile right now. I had my 10-day post-op appointment today with Dr. Sullivan. And he told me the more I smile and the more I kind of exercise my face, I'm going to start getting things back. And I know that's true too, because after my SFOT surgery, I went on a hiking trip like 2 weeks later and I couldn't move my face. And within like 3 days of hiking and talking with friends, I was back to normal. That's different. This was a much harder surgery, but kind of same concept, I feel like. And I got my rubber bands off today. I'm allowed to take them off now. And I'm afraid I won't put them back on because they're really uncomfortable. And the tads are just uncomfortable too because I have two right here. And they're kind of coming into the folds of my Le Fort cuts and my Genioplasty cut. So like the screw in here is kind of situated in that soft tissue, so I'll have to like go into that swollen area to put the rubber band. So he told me if that's too difficult not to do that and I can just attach them here. I tried to eat scrambled eggs today. Big fail. Then I tried to blend them. Then I tried to eat pudding, and then I just kind of gave up and went back to a cup of soup. But at least I can get a cup of soup in. I can open about a finger's distance. And I hear my joints, which is kind of cool, opening. You know, it's interesting because it feels like my body already. Like I thought it was going to feel like this big metal thing in me, but it already feels like it's part of me. So I'm really excited that part doesn't feel different about myself, that I'm like not different in that way. Like, so that's cool. Sometimes when I swallow, I like hear this kind of cracking noise from the pressure of my tongue up against the roof of my mouth. So I feel like that's kind of the Le Fort, and it's not super settled yet, so I don't really enjoy feeling that, but I think that's fine. My biggest complaint today is my deviated septum. It's pretty deviated, and it's hard to breathe out of the left side of my nostril, and that area is numb. And this is not something that is usually a complication with total joint replacements. So if you're considering a total joint replacement, I wouldn't worry about this. I'm kind of unlucky. So it just happened to me. So I'll probably in 6 weeks or longer go to an ENT in Dallas and get the septum repositioned, because Dr. Sullivan offered to go back in through the Le Fort cut and reposition it, but I don't want the extra scar tissue, and at this point we're not sure why it deviated, so I'd rather have an ENT doc look at that and fix that, and maybe even reduce my turbinates and see if I need any other work for better nasal breathing. So that'll be another surgery, and that's kind of unfortunate, but it is what it is. And if there were any complications to happen, I'm fine that it was my nose and not something within my joints. I'm still taking antibiotics and pain medicine, but I've only taken 300 milligrams of ibuprofen today and half a Norco, and some Klonopin to manage. I'm mainly having muscular pain on this muscle today because, of this being stretched and then the Genioplasty pushed even more, it's really stretching that muscle. And I don't know why I'm feeling that today, 10 days past, the surgery, but I feel it today, so I'm just trying to be good on the Klonopin to relax that muscle, and my doctor told me I can kind of stretch it and go up. And it's also easier to talk without the rubber bands, and I wasn't given any exercises for like opening and closing. I'm talking to some of my other ICR friends and they're given exercises, but he said don't worry about it for now. So each surgeon has their own protocols and how they like to handle post-op healing, so I'll just go with that, and hopefully I see improvement in my bite opening. And I think the reason I can't open very wide right now is just, again, the swelling and the tightness of the master muscle being cut through. And then I learned today that I had one of my zygomatic muscles. Like if you look up the anatomy of the face, there's like multiple zygomatic muscles, so I have no idea which one, but he had to kind of suture one, which kind of made something also tight. So I think it just all goes into being able to open. But my joints are able to open all the way right now. I think it's just the swelling and muscular that keeps it from opening all the way. I've also had a little like soreness in my scalp, and another friend who had this operation a week before me, she had the like pain in her scalp sooner than I did, but like if I put my hair up in a bun and then let it down, it just kind of hurts. So I've been just kind of massaging it and doing stuff like that. And then I'm going to start doing scar treatment now that I'm feeling kind of up to it and healthy, and doing like this on my face too. Just this ice roller, kind of get some lymphatic drainage going and hopefully start getting some feeling back on my face too. And then just listening to my body too, if I feel like I need ice or if I need heat. Like, I feel like I've needed heat more, so I'll use my heat pad from my first jaw surgery. Just like sometimes I'll need it like here or here, just wherever I feel like my body needs it. It's good to be able to just listen to your body, and you know, it kind of lets you know what you need. And then as far as scarring goes, I feel like I need to start doing some stuff, because I think as I'm moving my neck, like I have a lot more movement. I thought these muscles would be really tight. I think I'm stretching out the scar. So I think I'm going to start putting on like some silicone patches onto that, so that it, like when I move, maybe it restricts that. And I think my ears, they're doing okay. Some of the last of the adhesive is coming off, and it's still very swollen and puffy. Like if I'm touching here, I can kind of feel it now. Maybe I can feel it like 20%. So yeah, feeling's coming back. I still really don't have a lot of feeling here. I'd say it's like I can feel 15% of it, but I'm just gonna keep rubbing it and trying to get that sensation back. But it's not bad. It's not the same feeling as like getting a cavity filled and then they numb you up. Like it's not like that. It's just like I don't notice it unless I touch it, and then I'm just like, I can't feel that. So even if that feeling never comes back, like don't worry about it. That's not a huge loss. It really isn't. And that is my update on talking and everything so far.